Hi, in this presentation, I'm going to be talking about food allergies and specifically different ways that there are to figure out just exactly what you are allergic or sensitive to. I think most people know that allergies can play a big role in health, and figuring out just exactly what foods we're allergic to can play a big role in how we feel and to what degree we can recover from illness. But there are so many different ways to figure out what you're allergic to. I think that's where people start getting confused. So this is a summary of the different techniques that I'm going to cover. I'm going to go over traditional lab tests such as skin and blood testing, the functional IgG test. That's the type of test you might get from going to like an integrative medical doctor or a naturopathic doctor. Alcat test, which is kind of similar but a little bit different. Saliva tests, various blood tests such as for celiac, allergy elimination diets, then home tests like a pulse test. And then at the end, I'll talk about in-office testing that you might get by going to some type of natural health care practitioner. Let's first go over the difference between allergy and sensitivity. In lay terms, we use the word allergy all the time, and often it's to designate that there's some type of food we have a negative response to. But, sometimes there are immune system responses, and other times there are non-immune system responses, such as a lactose intolerance is a negative response to having milk, yet it's not actually an allergy in technical or medical terms because it's not an immune system response. So technically, in order to be an allergy, we do need to see some type of inflammatory immune system response. But I think in terms of lay terms and in terms of figuring out just exactly what you want to avoid, this isn't that necessarily that relevant. However, it does become relevant when we go over certain tests because many of these tests are designed to pick up allergies and not any general sensitivity. There are many different types of allergic responses, and this can get confusing, so I'll try to keep it simple. But allergies are mediated by something called immunoglobulins. That's part of our immune system that recognizes antigens or things for the immune system to respond to. And we have different types of these immunoglobulins, and depending upon what immunoglobulin is responding to the allergen, that's going to be a different type of allergy. So IgE allergies are typically immediate responses, like anaphylactic response. So if someone has an allergy to a bee sting, for example, or if you eat a food and like immediately you can feel your tongue swell, that's an immediate IgE response. And traditionally, when we talk about many seasonal allergies or what many allergists will look for, they're actually testing for IgE responses. So one way to see if you have an IgE allergy is to do a skin prick test through an allergist. And these are good for environmental allergies, and they will do food allergens as well. So if someone's positive to this test, then you can say they have an IgE allergy. But there are many different types of allergic responses and then sensitivities. So you can't say that because someone is negative to a skin prick test that they actually don't have an allergy. And that's something I'm going to repeat over and over again, that just because someone is negative to a certain type of test, that doesn't mean you can say that they are completely free of all allergic responses or sensitivities. The IgE allergies are mediated by histamine. So a lot of the over-the-counter allergy medications, they're called antihistamines to block histamine. And histamine should be helpful for an IgE-mediated allergy. But there are other types of allergic responses that are not mediated by histamine. And when it comes to food, this is going to be the IgG response. So IgG allergies, these are about long-term resistance, and symptoms might occur hours to days after exposure. So if you're allergic to peanut butter and you have an IgE response, you'll eat that and you'll know about it immediately if you're paying attention to your symptoms. But you can have an IgG response to peanut butter, eat it, and 2 days later, that's when the symptoms occur. And if you're not paying attention, it can be very hard to pick those up. So in case anyone's had some IgE allergy testing through a medical doctor and they're told that they don't have the allergies, it's important to know why IgE allergy testing is not enough. First of all, it does not rule out these other types of immune system responses. And, IgG responses are often acquired due to factors such as always eating the same foods over and over again and poor digestive health, while the IgE allergic response is not going to be sensitive to that. So, the danger is that someone goes to their doctor, they get IgE testing, they're told it's negative, and they're fine, when in the meantime they have some other type of response. But nonetheless, in the realm of conventional medicine, often doctors just tell patients that they don't have allergies. Well, look, we ran this test, it was negative, you're fine. But when we start going into the world of natural health, that's where all these different allergy tests come in. So there are many of these so-called functional labs that will have IgG food allergy panels. And they are available through Quest as well, so you can have through Quest or another major lab the IgG and IgEs done that way. But we'll see these other labs like Alcat, Genova, Immunolabs, Cyrex labs start putting together quite extensive panels looking for IgG food responses. These tests are okay, and if you've had them and you see a bunch of IgG actions, then you definitely want to avoid those foods that you're positive to. Although there have been complaints in the past where someone might do one of these tests and then things start coming up and they say, well, I never even ate them. So depending upon what lab, I don't know if these tests are absolutely perfect, but at times they definitely are helpful to help someone figure out what foods they can be responding to. However, because the immune system and all the different things in each food we can respond to is so vast and complicated, the IgG tests just simply are not perfect. So due to the complexity of immune system reactions, definitively ruling out an allergic response is complicated. So the following quote is right from Gluten Free Society. That's a great website with awesome information on celiac disease, gluten sensitivity. And just reading what it says, current testing for gluten reactivity and celiac disease includes serum IgG and IgA against gluten and tissue transglutaminase 2. These antibodies are measured against minor components of a wheat protein called alpha-gluten. However, wheat consists of multiple proteins and peptidases, including alpha-gluten, omega-gluten, gluten, and you can read those rest. All of these antigens have a capacity to challenge the immune system. So basically, you can get this IgG test and it's looking for your reactivity against one aspect of the food, but it's not covering everything. So it's very possible that you can get a false negative. So we start getting our panels like this, and this is an example of what Cyrex Labs is doing. So instead of saying that they're just doing IgG against gluten, they're putting together these huge panels to look for this aspect of wheat, that aspect of wheat, and looking for all these different glutens and transglutaminases, just to tell someone if they're actually having a reaction to wheat. And at the end of the day, this test is still not 100%. And to be honest, the real reason why practitioners probably give this test more often than not is because they want some paper with a positive test result to wave in front of their patient in order to prove to them that they shouldn't have wheat, because it's in everything. Now, you know what? Wheat is not really a natural part of the human diet. It's something that's been introduced fairly recently. Our bodies really aren't that designed to run off of grains as we might think. And we know clinically that many people have these responses and they feel better going off wheat. However, telling someone to avoid it is really annoying. A lot of times they're not going to follow through, or if they follow through, they're not going to do so sufficiently to totally avoid wheat. So practitioners might feel that they need this paper to prove to their patient that they definitively have the allergy. So this type of test from Cyrex Labs definitely is a lot more comprehensive than just doing a single IgG against wheat. However, none of these IgG tests are 100% for sure, because maybe you're having a reaction to something that the test isn't even looking at. And at the end of the day, it's like this. It's much easier to show someone that they have an allergy than it is to show someone they do not have an allergy. And that's just a basic problem in science where it's very hard to definitively disprove things. And because there's no lab test to say you don't have this, all we can do is create different lab tests to say, oh, now we're seeing this type of positive response or that type of positive response. There's no test that anyone could come up with that shows their body doesn't have any sort of response. And that's really why this becomes very complicated. But what I don't want people doing is eating foods that they are truly allergic to, that they are having negative responses to, but they just continue eating it anyway because they have some lab test that says that they're negative against it. If you see a clinical response to food and you see that allergy, then you have it, regardless of what any lab test says. That's going to be the bottom line. And then sometimes people get these IgG panels done, and the whole test lights up. They say they're positive to this, they're positive to that. It's like they have an allergy to everything. In this case, what you really have is a problem of leaky gut. You have inflammation across the digestive system. You have proteins or antigens from foods crossing over. The immune system is responding to those things. And, people sometimes take these tests and they say, look, I'm allergic to my entire diet. Well, you can go then in that situation, remove all these foods you're allergic to and come with a whole new diet, do the test in a couple of months and see if you become allergic to the new diet. In those cases, you just really have to work closely with someone at healing the gut and do the best job at avoiding the allergies that you do have, avoiding the wheat and the dairy and those really major ones. But, sometimes this happens. Other times someone can get an IgG test and it shows they don't have any food allergies, things don't light up on it. And it might be because they truly don't have many food allergies, if any at all. But it could also be that the test is wrong, they're getting false negatives, it's missing things out. And also a lot of times someone will run one of these fancy tests and it tells them that they need to avoid milk and wheat. That's one of the reasons I don't like to tell people to spend $300 on an allergy test, because I already know walking in they shouldn't have those foods. But sometimes if someone needs that lab to be convinced, then maybe the best thing they can do is to get one of these tests done to convince them. IgA is yet another type of response that a few companies will make tests to, specifically Cyrex Labs and Diagnostech. So whereas IgG is in the blood, IgA is secreted across the mucous membrane of our digestive tract, all the way from the mouth to through the large intestine and past that. So when there's an IgA response, that's showing that there's some type of immune system response across the lining of the gut wall. So this can be good. This is to pick up allergies as well. Diagnostech has a rather short panel, which is good for just gluten, eggs, and soy and eggs. So that I like that because that's a nice cheap panel, and sometimes people need to see that positive. And Cyrex Labs does a lot of IgA tests, but it's the same thing. If it's positive, it's positive. If it's negative, then it still might be positive, but maybe you have just an IgG response and you don't have an IgA response, or vice versa. That's just the way these tests are. Some of the nice parts about the IgA test is, at least the one from Diagnostech, doesn't require a blood draw. It's inexpensive. Diagnostech has additional IgA tests against things like H. pylori and amoeba, so actually they're a pretty good lab for finding some hidden parasites as well, because if the immune system is producing that response against those pathogens, then that pathogen is probably there, or at least it was there at some point. There's another type of test done by Alcat, and this is not exactly an IgG test. In the Alcat test, white blood cells are challenged with various substances, including foods, additives, colorings, chemicals, medicinal herbs, functional foods, molds, pharmaceuticals. And the patient's unique set of responses help to identify substances that may trigger potentially harmful immune system reactions. So they're actually looking for the response of white blood cells, that's our immune system cells, against substances. So Alcat will definitely claim that this is better than an IgG test. Now, this is a fine way to pick up allergies. This is a good test. However, this test might be negative, whereas another test is positive. And I had situations where people wanted various allergy tests, and they said they wanted the Alcat test, they want the IgA test from another company, and then they get annoyed because one test is showing a positive and the other is showing a negative. I had one case in particular where on the Alcat test, the gluten, which is the component to wheat, was negative, but then they had a positive IgA from another company. And they're telling me, well, that one of the tests is wrong. But I had to explain, the tests are not wrong. They're looking for different things. They were not seeing on the Alcat test a immune system response to wheat. They weren't seeing that in the blood, but the IgA test from Diagnostech was absolutely picking that up. So if one of these is positive, then that's a positive. And if anyone out there has multiple different tests and they say different things, it doesn't mean that the tests are wrong. The tests are just different. So just keep that in mind. And if you do get, say, an Alcat test from a practitioner, and then they say, oh, this didn't come up, you can eat it, use common sense. If it's wheat or dairy, most people probably have some negative response to that, and look at how you respond. The last thing that I want is, again, someone having a positive reaction with clear symptoms, and then they refuse to acknowledge that because some lab test says it's okay. The ultimate test is your experience eating the food. For celiac disease and gluten sensitivity, and by the way, celiac is just one possible expression of gluten sensitivity, the best test is the genetic test, HLA-DQ alpha 1 and beta 1 genes. There's more information about this on Gluten-Free Society, and it's promoted there because there are so many ways you can get a false negative on the allergy test. But if it's in the genes, it's in the genes, and you have it. It's an expensive test, but if this is what it takes to convince someone that they need to avoid wheat, then it's absolutely worth it. So the bottom line is that there is no such thing as a perfect food allergy lab test. All these tests may be helpful, but due to the complexity of the immune system reactions and sensitivities, there is no single all-encompassing test that can tell you what to eat and what not to eat. And you can always have a sensitivity, which is a non-allergic reaction to foods. So it doesn't matter how great the immune system test is, it's not going to show that sensitivity. So past this, then we can go on to the Allergy Elimination Diet. This involves the total elimination of most commonly allergenic foods for at least a month, followed by a reintroduction of possible offending foods one at a time while carefully tracking symptoms. So here you'll remove wheat, dairy, corn, soy, eggs, peanuts, citrus, anything artificial. Those are the major allergens. There are two drawbacks to the Allergy Elimination Diet. The first is that it's very difficult to do because you have to just rip out everything that's highly allergenic and just completely avoid it. And it's very then tedious to do the reintroduction. At least early in my career, I definitely gave many people the Allergy Elimination Diet. I don't know if anyone fully did it with all the reintroduction parts. I have people do the Allergy Elimination Diet, but I never had anyone comment 4 months later showing they eliminated all these foods and then they reintroduced this food and then a week later they reintroduced another food. I've never had anyone do that, so I don't believe people really are going to do that. But besides the difficulty in doing the diet and the tediousness in reintroducing foods, the other drawback is what if you're allergic to something that's not considered a very common allergen. So for example, on all the allergy elimination diets, you're going to see that quinoa is okay to eat. Quinoa is promoted as this amazing non-allergenic grain. I've had multiple people who are allergic to quinoa, and I've seen it on other tests that I'm going to get to later. But it's okay to eat on the Allergy Elimination Diet. Chicken is another one I've seen many people allergic to. They've had to get off of it to get better. Yet, according to a standard Allergy Elimination Diet, chicken is not considered a very allergenic food, so that's okay. And ultimately, people can be allergic to just about any food. The fruits and the vegetables are the least likely to cause a negative response, but unless you're going to do like a really hardcore Allergy Elimination Diet and start avoiding these additional additional meats, the shellfish for sure, and then start avoiding all the grains, it becomes incredibly difficult, and most people just aren't going to do it. Depending upon the philosophy of the practitioner you're seeing and what they've been introduced to, there are other types of ways to figure out what you have an allergy to. There's a simple test called a pulse test, and that's just eating a food and taking your pulse. If your pulse increases after eating a food, it indicates an allergy. There are certain practitioners, naturopathic doctors, who are using something called the Carroll Food Intolerance Assessment. That's looking for reactions in blood, but it's done in the office, and it's not looking for the immunoglobulins or anything like that. It's looking for more an electrical response. So that's a very good way of finding hidden allergens. Electrodermal screening, there are practitioners who do that. Now, in these types of tests, they're fast, they're inexpensive, they're done in the office, and when you see them work, they work. So it's really the results that matter. The technique that I use in office is applied kinesiology. There are many different techniques or ways to use applied kinesiology in practice. I think most people use applied kinesiology are chiropractors, but you will see some other types of practitioners use this as well. And this is simply challenging in terms of testing allergies or food sensitivities. This is simply challenging the body against the food substance and looking at their muscle strength. If the muscle strength drops all of a sudden when exposed to that food, then that indicates that the body really can't tolerate it that well. And when I say tolerate, that means that the body really can't handle it. It might be an allergy, it might be a sensitivity. You can't say exactly from kinesiology. It's not a lab test, it's not an immunoglobulin test, so I don't want to say it's an allergy, but it's a good way of finding these hidden foods that people should not eat. It's fast, it's cheap, you can get the results immediately, and when people follow the results of applied kinesiology, they get better. And that's all that matters to me, is that can I help my clients figure out what they should or shouldn't eat. If someone has the mindset where they're not going to make a change unless they see the result on some fancy test, they can do something like an Alcat test. That's what I tell them. Here's a $300 test, you can go ahead and do this, but I know this is what you should avoid if you want to get well right now, and you can start doing it today. But also sometimes people don't want to give up what they're allergic to, and I could do this test and I can repeat it over and over again and demonstrate to someone this is an allergenic food. You need to cut out the dairy, you need to stop having eggs every morning, and they'll start arguing. And the reason why they argue is because they're often allergic to what they eat the most, and no one wants to find out that they have to remove their favorite foods. So with some people, you do these testing and they come up with a couple of things. Other people, they just seem to be allergic to everything. So this indicates that something is wrong, and then you have to find out what's wrong rather than just going through life avoiding every food. We all know those people where they have to avoid this, and they have to avoid nuts, and they have to avoid those grains, and they have certain vegetables they have to avoid, and they can't have tapioca, and next thing you know, they have a list of 50 things that they're going through life avoiding. Now, certain foods, are just best probably avoided. Gluten, conventional dairy, corn, soy, genetically modified foods. If you have an IgE response to something, then you should also have to avoid that. But when it comes to developing allergies as you go through life, that's indicating a problem with the immune system, a problem with the digestive system that you really want to work on and get healthy. That way you can start eating these different foods. In this case, you really want to work on the gut, on the digestive system. It's really best to work with a professional who can customize a plan for you. There are going to be many considerations like digestive enzymes, soothing herbs such as marshmallow or aloe, of course probiotics, glutamine is very good. There's all sorts of so-called antimicrobial herbs, golden seal oregano, although they might not necessarily work just by being antimicrobial, but it's really best to work with someone who can match herbs to your overall constitution than just taking garlic or oregano because you heard it's good. It might be good for someone else, but but maybe not that good for you. And so there are considerations that a professional is going to have that you're not going to just get on an internet message board. Yeah, and I've had those cases, where people come in and they're eating all this oregano and garlic especially, and they say, well, they've heard it's so good for your gut. And then, looking at them and they have like a red, hot tongue with a thick line down the middle. They're sweating all the time. And like, yeah, it's good for those people because they're cold. You have a hot constitution. You shouldn't have it. And that's just, a common example of why it's best to customize the plan with someone rather than just taking what's good for another person. Now, if you are sensitive or allergic to food and you've avoided it for a while, then you can try doing desensitization. And this is good as a part of an overall plan to heal the body. There are certain homeopathics can be used for desensitization. That's the way that I work. But this is really something you have to do one-on-one with someone. And I'll just make a note that this is not classical homeopathy. I use a lot of homeopathics that say might be made from foods or allergenic substances to help desensitize the person. Another type of substance that someone might be allergic to or sensitive to are phenolics. So phenolics are aroma compounds found naturally in foods. They can be the underlying cause of allergic response. So for example, tyramine is found in beer, red wines, cheese, bananas, plums, figs, raisins, avocados, chocolate, and soy sauce. So you might have someone who thinks that, well, they're allergic to all those things, and they definitely are sensitive to them, but the real problem is that they have a sensitivity to tyramine. And if I'm working with someone and I see through the kinesiology that there's certain phenolics they're having a sensitivity to, then I'll tell them to avoid certain foods, but then we'll work on desensitization. On this final slide, I'll go over salicylates. These are chemicals that occur naturally in many plants, including many fruits, vegetables, and herbs. Salicylates in plants act as a natural immune hormone and preservative, protecting the plants against disease, insects, fungi, and harmful bacteria. Salicylates are also created synthetically and can be found in many medicines, perfumes, and preservatives. Some people might be sensitive to salicylates, and then they need to avoid it. The difficulty is that the diets involved in salicylate sensitivity are very broad in scope and incredibly difficult to follow. But there's the website on salicylate sensitivity. So if someone is incredibly sensitive to multiple different foods and they just can't figure anything out, then it might be something worth looking into. I'll just mention that to finish up. Okay, and thanks for watching. Bye.